The Virgin Media television survey has laid bare people's concerns over healthcare in the country. The Red C poll sought the views of more than 1,000 adults right across the country, and in it, there's a big concern over resources. 86% of respondents are anxious that in the event of a serious emergency, the response time will not be rapid enough. Michael McNamara, no surprise, as we say, and I think a lot of people will feel that way. But what you get from that survey, I think, is a deep fear of our health service. How real is that fear from people, say, in your constituency in Clare, many of whom would be facing the prospect of having to go to Limerick University with consistently the worst emergency department waiting times and highest numbers on trolleys?
Yeah, I mean, today is a rare day in that Limerick is not the most overcrowded hospital in the country. Today it is almost every day of the year. And, you know, there are people who are afraid, even when ambulance crews arrive, they're afraid to be brought to Limerick and reluctant to get in an ambulance because it will bring them to Limerick. Obviously, there's been a new protocol where a very small number of ambulance patients can be brought to Ennis.
And does that actually happen, that people say, you're bringing me to Limerick, you're all right, I won't go?
Anecdotally, I've heard that there's at least a reluctance. I mean, obviously it depends on how unwell somebody is, but you know, people don't want to be brought to Limerick, they want to go anywhere else. People will drive anywhere else. But the one thing, you know, there was a meeting at the start of this year that the Taoiseach attended along with all elected representatives, HSE management and management of the region. And it was encouraging, at least, to hear the Taoiseach acknowledge that Limerick and the region, the Midwest region, is under-resourced in comparison to the rest of the country. And of course, all of the country is under-resourced, but there's a particular under-resourcing in that region. And also Dr. Mike O'Connor, who's part of the emergency response unit in the HSE, acknowledging that the Model 2 hospitals, Nina, Ennis and St. John's, are underutilised. So the challenge is, it's easy to acknowledge something, but the challenge is to get more patients into Ennis, more patients into Nina, more patients into St. John's.
That would be, of course, reversing a plan and a decision that was made some years ago to change it all and centralise it in Limerick. But do you believe that that now is the solution and what needs to happen?
Well, I mean, the centralisation was regarding A&E patients. I mean, not everybody needs to go through an A&E, but at the moment, our health system is such that you can't get a doctor because there's a shortage of GPs. You can't see your GP, you're sick. So the only way to be seen is to show up in A&E. I'm aware of people who had an elective surgery planned for a long time, a necessary one, and they're told that there's no bed for you, and their consultant says, go to A&E. If you go through A&E, you'll find a bed. So at the moment, it's not just in the Midwest, but it's particularly acute in the Midwest, that if you want medical care, you've no choice but to go through an A&E. That needs to change. There need to be other avenues that you can access medical care, and not everybody needs to go. You know, there is a local injuries unit. Obviously, if you've had a heart attack or a stroke, you need the backup of the critical care unit, or intensive care, as it might be colloquially called. But not everybody needs that, and I suppose that is the challenge, to get people who don't need to be in an A&E, who don't need that a very intensive level of care, to go elsewhere. And the HSE need to plan for that, though, because I asked, you know, what resources are going to be given to Ennis given this announced change, and I was told, well, there'll be a review and we'll figure it out. Then I asked in the Dáil this week what was the result of that review, and the Taoiseach didn't know. And he's not supposed to know everything, but
sure.
I mean, we do need to stay on top of this and make sure that those hospitals are resourced to take some people away from Limerick.
Yeah, it is. A bed is simply not just a bed. It's a bed that is staffed accordingly. And we heard Phil Hay from the INMO saying staffing levels are such that it is difficult to safely treat people. And we had record numbers of children waiting admission in our emergency department yesterday, 46 children waiting for a bed. You know, the question is this any way to treat sick children? And can that promise of 1,000 beds, if it can't be met with the adequate staffing, you know, it's not really a promise that can ever be fulfilled.
Already it's about staffing. I mean, for the first time, I think now in Limerick, there are unfilled positions that they can't fill for a variety of reasons. But that's particularly concerning, that they're creating positions that they can't find people to fill, because one of the things when they declared an emergency was there were a lot more diagnostics available. People other than, obviously, nurses, doctors are hugely important, but you also need people in the laboratories, people in diagnostics, because you can't move people on in the A&E until you get diagnostics back. And there's a shortage in every medical profession, from doctors, nurses, radiographers, anaesthetists. I mean, there's a suggestion that a new surgical hub will help with waiting times in Limerick, but already we know that the theatre in Limerick is underutilised, and the theatres in Ennis, Ennis, Nina and St John's even more so, because of the shortage of anaesthetists and theatre nurses to staff them. So you can create this new space, you can kit it out, that's wonderful, but if you've nobody to enable the surgeons, if you don't have the support staff there to enable the surgeons to go in and carry out elective surgeries, it's not going to work. So there is a huge problem. It's been a long time waiting, but it is, I think it's important to acknowledge, particularly acute in the Midwest for historical reasons, going right back to the 80s. There are just less beds, less consultants, hospital doctors, less non-consultants, less nurses per capita in the Midwest, and that does need to be addressed to bring us up to the poor level that exists in the rest of the country.
And recruitment at the core of all of this, again, even if there are the beds and the positions available,
well, and then
it's
the worse
having
the
those
situation
positions
gets,
filled.
the less attractive it is for people to take a post in Limerick or even in the Irish healthcare system, because people just want to work in a civilised working environment without those huge pressures that A&E staff in particular are under.